This is a call to all postgraduate biokinetics and sports science students with an interest in exercise oncology. I'm Dr. Marianne van Aswegen and will act as the project leader for the Exercise Oncology project. Each year, 115,000 South Africans are diagnosed with cancer. Females have the highest risk to develop breast cancer and cervical cancer, while males have a higher risk to develop prostate and colorectal cancers. Clinical adjuvant therapy is often used to treat cancer and may consist of the surgical removal of the tumor, chemotherapy, radiotherapy, or hormonal therapy, or combinations of these treatments. Adjuvant treatment is associated with multiple side effects. Various researchers have shown physical activity to be highly effective in improving these side effects. It wasn't always the case. Cancer patients in the 1980s were generally recommended to refrain from any form of physical activity upon their cancer diagnosis. But this recommendation changed in the early 2000s. The need for physical activity in oncology patients is established and well recognized in countries such as Europe, Australia, and America. In Australia, exercise is rooted as part of the standard patient care as an adjunct therapy. However, in South Africa, there is a lack of recommendation to patients to continue with physical activity during and after their adjuvant therapy, and a lack of structured and supervised exercise oncology centers. Based on the socio-economic discrepancies between South Africa and the mentioned first world countries, a viable African model for exercise oncology research centers should be established. Due to the lack of structured exercise oncology centers in South Africa, this forms the first direction for the project. Secondly, the general health benefits have been well established for the major cancer types, such as breast cancers, due to the large number of cases worldwide. This is lesser known in the lymphomas and is an area to be further investigated. Thirdly, some of the chemotherapies cause neuropathies in the lower limb, which affects gait. Here it is necessary to establish which form of physical activity or training, for example aquatic versus normal balance training, would have the best and the greatest impact on the restoration of normal gait. I envision to have space for at least one master's and one PhD level student, depending on the interests and the directions of potential applicants. If you are interested in pursuing a master's or a PhD in exercise oncology, please feel free to contact me, preferably via my email 20383800@nwu.ac.za. I look forward to hearing from you.